Hi, my name is Chris. I work for the New Mexico Aging Services Department, and I am here to talk to you about changes to Medicare in 2025 and walk you through a little tutorial on how to use the Medicare Plan Finder on Medicare.gov to look at your options for Medicare Advantage plans. So I'm going to share my Medicare screen and get us to Medicare.gov. All right, you should be seeing Medicare.gov. It's so important when you look for Medicare information to go directly to the official source. So you see up here in the upper left-hand corner, it says Medicare.gov, and above that is an American flag that says an official website of the United States government. There are a lot of copycats and scammers, fraudsters who want to make you think that they're Medicare. So please be sure to get your information directly from the source. And that's how you can tell by making sure you're on Medicare.gov and that you see that flag. So when you get there, you're going to see this landing page. It may change during the course of open enrollment. They change the images regularly. But up here in the corner, it has a little blue section that reminds people about open enrollment, and you can click right here on the Find Plans button to see the plans that are going to be available in 2025. There are some big changes coming in 2025, one of which is the fact that prescription drug costs are going to be capped for every Medicare beneficiary at $2,000 for the year. So that is a great change. Unfortunately, as we all know, no change is all one thing. So partly in response to this, many of the drug companies have changed their formularies, meaning which drugs are covered or not covered. So for this year in particular, it's extremely important that you double check to make sure that your coverage is going to continue to be what you think it is. We've already received reports here in our office that some of the drugs that people have taken for years are no longer on their plan's formulary. So it's very important to check. And I'm going to show you how to do that today. So the first thing that we do when we scroll down on this page about the plans for 2025 is you have the option of either logging in using your Medicare.gov account or to continue without logging in. If you have created an account on Medicare.gov, this is definitely the way to go. It is a big time saver. You don't have to enter your medications, and it's going to show you your current coverage. And so if you do have a Medicare.gov account, I would definitely recommend logging in using that account. And if you don't have one, you might want to consider making one. Today, because this is a demonstration, we're going to continue without logging in. And so in order to do that, you put in your zip code. I've put in the zip code for the Gallup area today. We'll see what's available there. And this is the Advantage Plan tutorial. So we're going to look at Medicare Advantage plans. So we're going to click that button right there. If you wanted to just look at Part D plans, you could click there. We don't have an enrollment period in New Mexico for Medigap plans, so you wouldn't click that one. The Medicare.gov website is a national website, so it has other options that aren't available here in New Mexico. So since we're going to be looking at Advantage plans, I clicked that. We're going to go to Find Plans. The next question is, do you get any help with your Medicare health or drug costs? If you have Medicaid, if you have a caregiver and you're on the home and community-based waiver, you would click this button. If you get SSI, so supplemental security income, you would click the second button. Don't click this one if you're simply collecting your Social Security retirement. That's a different benefit. If you have a Medicare savings program like QMB or SlimB, you would click the Medicare Savings Program button. And if you get extra help with your prescription drug costs from Social Security, you would click Extra Help. Today, for simplicity's sake, I'm just going to click I don't get help from any of these programs, and we'll move on. When you do a plan search. You always want to click yes, you want to see drug costs. The only exception is if you don't take any drugs, and in which case, congratulations. Because for most people, their largest out-of-pocket cost is for their copays for their prescription medications. So that's how your plan covers that is a very important factor in whether or not any particular plan is going to work for you. So the first thing we're going to do is add the prescription drugs. So I'm just going to put in a few common ones. I'm going to start with Eliquis. You see, I started typing. The drug names populate down below, and you have to click on the drug name in the drop-down menu, and then push the Add Drug button. Because this is a demonstration, I'm just going to keep the default dosage and quantity and add it to my drug list. But if you're doing this at home, you're going to want to update it to your actual dosage and quantity. One important thing to know about this section of the preparation for looking at plans is that you need to keep the frequency consistent for all the medication. The plan finder freaks out a little bit if they're different. So if you know you're going to pick up your drugs in the pharmacy every month, then leave it at every month. If you plan to get mail order, in which case they send you a 3-month supply, put it on every 3 months. I'm going to leave it at every month for our demonstration. All right, so I'm going to add a few more drugs so that we have some interesting things to look at when we're doing our plan. So I am going to next put in metformin. I chose this example because it's so important to know the exact name of your medication. As you can see, there are many different variations on metformin. So this is a classic case of garbage in, garbage out, right? As long as if you don't know your exact medication, you're not going to get accurate information to base your decisions on. So please make sure you know exactly what your drug is called. In this case, I'm going to go with sort of the standard metformin hydrochloride, blah, blah, and add that one. And then the next one, I'm going to put in a really common inhaler, Advair. We'll add that one. This one, if your drug has a generic option, then this little box is going to pop up. And you can either add the generic, or if you know that you can't tolerate the generic, you can click Keep Brand. In this case, I'm going to add the generic. And keep the standard dosage. All right, the next one we're going to put in is lisinopril. It's a very common blood pressure medication that a lot of people take. The standard. And last but not least, I'm going to put in another diabetes medication, Humira. Okay. You can see that the time saver of going in through your account, so you'd have to add all the drugs, can be a very nice benefit. Because this is what happens if you don't click on the drop down. I typed the whole thing and hit return, and it's like, what? I don't know what you're talking about. So you always have to click on the name in the drop down menu. Okay. This one doesn't have a quantity listed already, but I'm going to go in and select that. Add that to my drug list. Righty then. Okay, so I'm going to say that that's all of our drugs for now. We're done adding drugs. And next, the next thing that comes up is adding the pharmacies. So we've already got the zip code in. We put it in at the very beginning. So this is showing us all of the pharmacies within 25 miles. You can lower that. You can change this to within 1 mile or 5 miles or 10 miles. We start with a pretty big window. Now, when we put in the pharmacies, we're not making a commitment to get our drugs in a particular place. What we're doing is seeing how where we pick up our drugs, which pharmacy we use, would affect the cost. So I always put in mail order. I am also going to put in Walmart, Safeway. Sometimes those grocery stores have great prices. I'm going to put the Gallup Indian Medical Center Pharmacy. If you're Native American, that's one that you're likely going to use. You can see there's a Tallahatchie Health Center Pharmacy. And I think I'll put Walgreens here also. Okay, so you can see down below in this blue box, there are 5 pharmacies selected. So I'm going to hit done. All right. We're going to let the website catch up with us here for a minute. So now we're on the page that's going to show us what Medicare Advantage plans are available in the area we chose, which in this case was Gallup. And there are 9 Medicare Advantage plans available. You can see by looking right here. Under plan type, you can select if you know. So with the Medicare Advantage plans, the Medicare Advantage plans in New Mexico are generally either an HMO or health maintenance organization or a PPO. If you know you only want to look at PPOs, preferred provider organizations, you can click this, apply it, and it will filter out anything that's not a PPO. So you can see that now we're down to 8 Medicare Advantage plans. The next thing that we can filter by is the plan benefits. Let's say, the only reason I'm even looking at a Medicare Advantage plan is because I know I need vision, dental, and hearing coverage. So we want to make sure we're only seeing plans that offer that. There are also plans that offer transportation benefits and fitness benefits. You can click any of these and it'll filter and screen out any plans that don't have that as an option. I'm going to leave it on dental, vision, and hearing for right now. Oh, now we're down to 7 plans. You can also filter by insurance carrier. Looks like in the Gallup area, there's only a choice between Blue Cross Blue Shield or Humana. I'm going to leave both of those. I want to see everything. The next thing I'm going to do here is I don't even want to see a plan that doesn't include drug coverage. So I'm going to click the includes drug coverage button and apply that. And we'll see what happens to our selections at that point. So now we're down to 6 possible plans. You can also filter by star rating, right? I'm gonna just look at everything that we've got here, and you can see what we filtered by up here. They show up right here. Now, this is all the preparation, right? We haven't even looked at a plan yet. Plans right now are sorted by the lowest drug and premium cost, because those are the out-of-pocket costs that are going to be the most predictable. They can also be sorted by deductible, or the lowest monthly premium. I don't recommend that. I like to leave it on lowest drug and premium cost, because that lets you know what you can count on as your baseline healthcare costs month by month. So now let's take a look at some plans. The first one that pops up is this Humana Choice PPO. It has a monthly premium of $13.90 a month. Over here, it says that it has vision, dental, and hearing. There's green check marks next to each of those. It doesn't offer any transportation benefits, but it does have a fitness benefit. We can see that with the drugs that we selected for this plan search, we can expect a total drug and premium cost for the year. This is what they estimate for the whole year, of $1,651. It has a $1,000 annual deductible for health and a $200 drug deductible. This is very important information, the in and out of network maximums. So it has an 11,700 in and out of network maximum for healthcare and a $7,200 in network maximum for healthcare. Anytime you see one of these little phrases with the dotted lines underneath, you can click on it and it will give you an explanation. So maximum you pay for healthcare services. Once you pay this amount in deductibles, copays, and coinsurance for services, your plan pays 100% for covered health services. So with a PPO, you can get your care in or out of network. If it's in network, you generally have a lower copay and you'll have a lower out-of-pocket maximum if you get all of your health care in network. If you go out of network, say you want to go to a specialist that's not in network for your plan, you can go there and the plan will cover a lower percentage of that cost, and it will also increase your out-of-pocket maximum if you choose to do that. But you do have the choice. So with this plan, the primary doctor has a $0 copay and a specialist has a $50 copay. So this is not enough information to base your decision on. And let me show you why. Before you make any commitment, before you enroll in anything, you always need to check the full plan details. So you can see here, there's a green enroll button. You can enroll in the plan directly from Medicare.gov if you choose to, but you always want to start by clicking on the blue plan detail button. So now we're here, we're looking at a lot more information than was on that summary sheet about the Humana Choice PPO. So we can see here the total monthly premium, $1,390, the health deductible of $1,000, the primary doctor copay of $0, and your estimated total drug cost of $1,484. And this is really important. It covers all 6 of the medications that we put in. So let's look a little bit deeper. The overview is going to show us the same information again. You can skip directly. The first thing that I want to do, this is one of my little pro tricks I'm going to share with you. I don't even want to waste my time looking at a plan that doesn't have decent vision, dental, and hearing coverage. So I'm going to click on this extra benefits right here, and it's going to take me directly to that portion of the details. And I can see that this plan does cover hearing with a $0 copay in or out of network, right? Covers the fitting and evaluation. Even though this plan does cover hearing, you're still going to have a $700 to $1,000 copay on hearing aids, right? And it doesn't cover over-the-counter hearing aids. So if you go to Costco to get your hearing aids, which I know a lot of people who do, including my brother-in-law, this may not be the right plan for you. Now I'm going to take a look at the dental next. The dental is divided into 2 sections: preventive dental, which includes your oral exam, cleaning, fluoride treatment, and x-rays for your yearly or twice a year checkups that you go to. The preventive dental with this plan is covered with a $0 copay. They don't cover fluoride treatments, but they cover everything else. Comprehensive dental is what if you go to the doctor, the dentist, and they tell you, oh, you know what? You need a root canal. You need a filling. Comprehensive dental is not covered at all under this plan. So that's why it's not enough to just look at that summary at the first part of the plan search and say, oh, look, there's a green check mark. That must mean my dental is covered. Because sometimes it isn't the way you think it would be. So what this plan does is they don't even offer an add-on policy, it looks like. So sometimes they'll offer an add-on policy to allow you to get that comprehensive dental, but this plan doesn't seem to do that. So if you wanted a dental plan that actually covers any dental needs that you have beyond just getting a checkup, this isn't the one for you. So I am going to go back up to the top. I'm going to just stop even looking at this one. And I'm going to move on to the next plan. Okie doke. Let's get those plans back. See if we can find something better than that. Okay. So the next one after the Humana, this was Humana Choice PPO. The next one is a different Humana Choice PPO. It has a different, you look at this. This one is 196. This one is 223. Okay. So it's a different plan, even though it looks like it's the same. This one has a $7 premium, monthly premium. It also says it covers dental, vision, and hearing. It estimates the yearly costs for your medicines at $1,697. So that's a little bit higher. But it has a primary doctor copay of $0 and a specialist copay of $45. It's a little bit less. So and also the in and out of network maximums are a little bit less. So let's look at the plan details and see how this plan is different from the Humana plan we were looking at just a minute ago. So we've got that base information. It covers all 6 of the drugs, just like the other one. So let's go look at those extra benefits again and see what they're doing with dental, vision, and hearing. So it looks like it is mostly the same on hearing, although I noticed that on this plan, instead of $700 to $1,000 copays for prescriptions, this one is $400 to $1,000 is the range. So that looks like it's a better benefit already. The preventive dental looks the same, but up here I can see that it does have some comprehensive dental coverage. So restorative services, which is like getting a filling, a crown, you do have coverage for that with a $25 copay. Endodontics, which is, I believe that's root canals, not covered. Periodontics, which is gum disease, that's covered with a $25 copay. Prosthodontics, which is dentures, not covered. Prosthodontics fixed, which would be like an implant or a bridge, not covered. Okay, so there's a lot that's not covered. And then they do cover routine eye exams, contact lenses, and frames. So this is better than the previous plan, but it's still not great. So I'm going to click back on the overview. I'm not going to give you, make you seasick by scrolling back through the whole thing this time. So if I click on overview, that takes me back to the top. And I'm just curious to see if we can't find something better than this. So let's see what the third plan on the list is. So it's so important to actually look at the benefits and not just the costs, because if something that you need is not covered, your costs are going to end up being higher. So we started with this one, which had the total cost of $1,600. We looked at the next one, which is a little bit high, closer to $1,700 for out-of-pocket costs for the year. Whoa! Blue Cross has a $0 monthly premium, but look at your total drug and premium cost, over $100,000. That's crazy. You might remember that at the beginning of this video, I told you that there's a $2,000 cap on drug costs. So let's look at the plan details, and I'm going to tell you why we're seeing that crazy number right there. Okay, so let's peek here. It's trying to figure out how many drugs are covered. 4 of 6 drugs on our formulary are covered on this one. So this plan has a 0 monthly premium, but it only covers 4 of the 6 drugs that we need. So we're going to take a quick look down here at the drugs. So you can scroll down. It gives you lots of information about how much your copays are for primary doctor or specialist. But I want to look, tells you what you can expect in terms of copays if you're end up in the hospital or emergency room. But let's take a look at the drug coverage. So here are the medications, right? And if I keep scrolling, it is going to tell me what is not covered when I get down to this yearly drug cost by pharmacy section. So this particular plan does not cover Humira or Osphena. So you're paying full price for that, which is where we ended up with a crazy number. That $2,000 cap on drug costs only applies to drugs that are on your plan's formulary. So if you are taking a medication that's not on the formulary, you still have to pay the full cost out of pocket. So that's one of the reasons that I say that it's extra important this year to make sure that you double check everything, because you don't want to end up with higher costs on the year when costs are being capped at $2,000. So I'm going to go back up here. So despite the fact that those Humana plans had terrible dental coverage, they're still better than the next option because they at least cover the medications well. So I'm going to go back here, and we're going to go back to that second Humana plan, and I'm going to show you a few other tips and tricks that you might find useful if you're doing a plan search on your own. So the second Humana plan, this 223, had better dental coverage. Let's take a look at it again. Since after our search here, it seems like it might be our better choice. So I'm going to scroll through. We see that base information again, a $7 monthly premium, which is for the drug plan. Your standard Part B premium. They have not yet released the Part B premium for 2025. We do expect it to go up. What they're still showing is the 2024 Part B premium. They will update the plan finder to show the new premium as soon as it's released by the government. This plan has a $750 annual deductible, a drug deductible of $200. The out-of-pocket maximums are $10,000 for in and out of network, or $5,400 if you get all of your healthcare within your plan's network. Okay, 0 copay in network for a primary doctor. If your primary doctor is out of network, but you love them and you don't want to give them up, it'll be a $30 copay per visit. Specialists, $45 copay. Out of network, $75 copay. Some offices will require you to submit your own billing to your plan if you go to an out of network doctor. So just be prepared for that if you make that choice. So this plan covers diagnostic tests and procedures, lab services, radiology like MRIs, X-rays, $125 copay per emergency care visit, $55 for urgent care. If these things are important to you, you're going to want to spend a little more time looking at them. With this plan, if you are inpatient at a hospital, you'll be paying $300 per day for days 1 through 6, which means if you're in the hospital for a week, you'll have an $1,800 copay. And then if you're in the hospital for 2 weeks, you don't have any additional copays beyond that. Outpatient, you have between a $0 and a $300 copay per visit, depending on what you're doing. Another important thing to look at is the skilled nursing facility. It's $10 per day for days 1 through 20, which is not bad. I have to say that would be if you were in the hospital, in the skilled nursing facility for 3 weeks, you'd have a $200 copay. But it goes way up. It goes up to $214 per day if you're in longer than that. And if you go to a nursing facility that's out of network, then you pay half the cost. Okay. Preventive services. So we can click on this. It'll tell us more about what is under preventive services. Flu shots, things like flu shots, colonoscopies, certain kinds of screenings have a zero copay. Others, like a glaucoma test, diabetes self-management training, EKGs, barium enemas, you have a copay, right? So you will need to contact the plan to find out the specifics. All right. This is a really important thing. Anytime you see a dark blue bar with a plus, click on it and it will tell you more. So this is where we find how mental health counseling and therapy is covered. So this plan does cover counseling, mental health services with a $45 copay or half if you're out of network. It covers opioid treatment programs and other services like durable medical equipment, which includes wheelchairs, oxygen, prosthetics, dialysis, right? If you need dialysis with this plan, you'll have a 20% copay, coinsurance, and diabetes supplies, like your test strips and needles and things like that fall under this section. So you always want to expand anything that's expandable. All right. And now let's take a deeper look at the medications. So the first thing is your drug list. These are the drugs that we put in. If you wanted to change them, maybe you say, oh, you know what? I put that in, but I only took it once last year. So I'm going to go ahead and take it off. You can click right here and you can change what drugs are listed, and that'll impact what you see when you're looking at the details. Okay. So we already know that all of the drugs are covered under this plan. The next thing that's so important to look at is how does the pharmacy that you get your medications come from, how does that impact your costs? So there's a big banner here that says a preferred in-network pharmacy may lower your costs, and you can look for preferred pharmacies here. So all of the ones that we selected, Walmart, Walgreens, Gallup Indian Medical Center, Safeway, and mail order, they're all standard in-network pharmacies. A preferred pharmacy could have lower costs. Let's check to see if any of the other pharmacies that we didn't choose are preferred. So this says mail order is preferred. And I'm just scrolling down to see everything else looks like it's in network. So I think we're okay with our pharmacy choices. Generally speaking, a preferred pharmacy is going to have lower costs, lower out-of-pocket costs. So let's see exactly what the next section shows us exactly what those costs are likely to be. It's really important to remember that the drug costs in the plan finder are an estimate. Drug costs can change throughout the year based on a variety of factors, including supply chain issues and just the cost of the ingredients and whatever other things that they use to set their prices. So if we go with mail order, you can see that the Eliquis at Walmart is going to cost $118. At Walgreens, $110. At the Gallup Indian Medical Center pharmacy, it's $85. Safeway, we're back up to $118. And mail order, it's $94. So you can see that just where you choose to pick your medications up can make a huge difference in the cost. because they all have different agreements and different suppliers. So depending on where you decide to get your medication, your overall drug copay costs for the year can change, can vary hugely. Look here. Here's mail order. It's $878 estimated for the year. And every place else is twice as much. So it's really important to look at all of the pharmacies to get as much information as you can before you make a choice. Because you may think, I don't want to do mail order. But when you see that it cuts your costs in half, you may decide it's worth it after all. Okay. Another change for this year is the option of using a Medicare prescription payment plan. This is an option that helps spread your drug copays over the year. It does not lower your costs. What it does is it makes each month's bill more affordable because instead of paying the entire copay at once, it'll spread it out for you. Okay, but you still end up paying the same amount. You just don't do it all at the same time. If this is something that seems like it would make sense for you based on your copays, your pharmacist or your plan will send you information about it. It's not something that you sign up for in advance. It's something that you'll learn about if it seems like it's relevant for your situation. So the next thing that I want to show you here, the estimated total monthly drug cost shows what your copay is going to be. Boy, you definitely, if this was your drug list, you definitely would want to sign up for the payment plan because $1,600 for your medications in 1 month is a lot, right? You don't want to pay that all at once. So if you signed up for the payment plan, they would take that $1,600, divide it by 12, and that would be your monthly cost. But you hit your deductible and you hit the out-of-pocket maximum in this case. And so for the rest of the year, you have a zero copay on all your medications. Okay, and it tells you more about that out-of-pocket maximum right here in this section. One thing that I wanted to show you, I love this little feature of the Plan Finder. If you know that you want to get your drugs someplace, you're like, I only go to town once a week and I do my shopping at Safeway and that's where I want to get my drugs. So you can click on it because remember, anytime you see a plus, you're going to get more details if you open that up. And let's look and see what things cost at Safeway. So at Eliquis, the retail cost is $573. Before the deductible, you pay $573. This plan has a $200 deductible, so you're going to hit your deductible right away. After the deductible, the cost is $47. After the out-of-pocket cap, that $2,000 cap, then the copay is zero. There is no more donut hole. The donut hole has fully been eliminated for 2025. And so you can see that for each of your medications. Ooh, look at the Humira. Good thing this thing is covered on this plan because the retail cost is $6,784.47. After the deductible, it's $2,000. And then after that out-of-pocket maximum, which obviously if you take this drug, you're hitting in January, it's going to be zero. So you definitely sure if you take this medication, it is on your plan's formulary, right? Lisinopril, $4. That's the kind of med I like to take. Cost before the deductible is zero. After the deductible is zero. They're not even going to charge you for it. Same thing with the metformin hydrochloride. Okay, so you are not going to pay $7,476 or even $2,153 because we have that $2,000 out-of-pocket maximum on medications, and you've selected a plan where all your drugs are on the formulary. So that's a good thing. That's why you need to make sure to double check it. Okay, if you want to look at more, like you want to know about step therapies, you want to know about tiers, you're going to find all that information under here. So we've already gone through the extra benefits. So I'm not going to go back there. And we're going to go back to the overview. So just to summarize, it's so important to double check this year more than ever that all of your medications are on your plan's formulary and that the plan really has the benefits that you need, that you're looking for. I hope this tutorial has been helpful for you, given you some ideas about what's important to look for, what to watch out for, and how to extract the most information possible out of the plan finder. Our SHIP counselors are doing in-person Medicare counseling and assisting people with plan searches all across the state, all the way through December 7th. So if you dig into this a little bit and think, you know what, I really want somebody who is a professional to help me with this, please, you can go to the Aging and Long-Term Services Department website to find a complete list of in-person events. You can also call the Aging and Disability Resource Center at 1-800-432-2080 and request an appointment with a SHIP counselor. We do phone counseling as well. So there's lots of ways to get help from an unbiased expert SHIP counselor who can help you sort through all of your choices and make sure you're not going to start 2025 with some unpleasant Medicare surprises. Thank you so much